We have got to change the direction of this town. And to my colleagues on the other side of the aisle, yes, that means touching Medicaid.
Touching Medicaid isn't how we fix what's broken in Washington or this country. Medicaid is not broken. But you know what is? The moral compass of politicians who vote to cut Medicaid and then pretend it's making the program better.
It went from $400 billion in 2019 to $600 billion this year. It'll be over $1 trillion in the 2030s. We are making promises that we cannot keep.
$600 billion sounds huge, right? Well, it only accounted for 8% of federal spending in 2024. Politicians like to wave big numbers around, making you think government programs are wasteful. But here's the truth. Medicaid cuts lower healthcare costs, not by being helpful reining in corporate fraud and abuse, but by kicking people off a program, Medicaid, that they would be bankrupt without. This is wrong.
We do need to reform it. We need to stop giving 7 times as much money to the able-bodied over the vulnerable. Why are we sticking it to the vulnerable population, the disabled and the sick, to give money to single able-bodied male adults?
Identity politics won't work. This isn't about able-bodied versus disabled-bodied male workers, or even work requirements, which are a sham when you consider that 71% of people on Medicaid already work. The remainder are people who can't work or find a job or are taking care of children or are children themselves. But we're seeing Republicans' grand plan now. They're working hard to loosen child labor laws so those children can work their way off Medicaid too. Cut the BS. This is and has always been about funding permanent tax cuts for the rich. The only reforms we should be talking about are investing more in Medicaid and expanding access and benefits. And we can cut costs by ending predatory practices by private health companies.
We shouldn't do that. We should reform it. But guess what? That message needs to be delivered to my colleagues on this side of the aisle too. We are writing checks we cannot cash, and our children are going to pay the price.
You're right. These tax cuts will explode deficits. We and our children and our children's children will be paying for this massive upward wealth transfer. Republican Medicaid cuts could kill an estimated 21,600 people. We cannot stand for that. This suffering is a policy choice.
So I am a no on this bill unless serious reforms are made today, tomorrow, Sunday.
Glad you Republicans oppose this budget bill, but for all the wrong reasons. Every time it comes around, you need to say no. Want fiscal responsibility? Go after United Health's Medicare Advantage fraud, close tax loopholes, make billionaires pay up. Instead, you prey and extract wealth from all those without corporate PACs, average workers, disabled people, children, seniors. That's not budgeting. That's bullying your constituents for your big donors. This is a shakedown.